All right, we're back into Chapter 12, the primary assessment. The topic we will discuss is going to be the primary assessment. And in this section, we're going to talk about the primary assessment. Approach to the primary assessment. You want to focus on life threats: airway, breathing, circulation. It may vary depending on the patient's condition, how many EMTs are on scene, and other priorities you determine as you assess the patient. Order of ABC depends on the initial impression of your patient. The sequence will vary. ABC if the patient has signs of life, and CAB if the patient appears lifeless and no pulse. Immediate interventions may be needed. Remember what ABC is. ABC is airway, breathing, circulation. CAB is circulation, airway, breathing. Any vomit in the airway that enters the lungs is very serious and often fatal. Exsanguating bleeding must be stopped immediately. Breathing and circulation are obviously vital for life. Make sure your patient is breathing and breathing adequately to support life. If immediate interventions such as bleeding control or CPR are not required, shift into an important but less urgent mode in which you will administer oxygen appropriate for the patient's condition and evaluate for shock. Performing the primary assessment, you need to form a general impression, assess their mental status, assessing the airway, breathing, and circulation, and determining their patient priority. Forming a general impression. You want to assess the environment and the patient's chief complaint and appearance, help determine the patient's severity, and help set priorities for care and transport. Forming a general impression includes your immediate assessment of the environment and the patient's chief complaint and appearance. Beginning spinal motion restriction. Treat the patient's life-threatening condition while not aggravating a potential spine injury. Apply initial SMR to the head and neck on the first contact with any patient you suspect may have an injury to the spine. Continue SMR throughout the call unless a physical examination determines that it is not necessary. Manual stabilization of the head and neck holds the patient's head still in an inline neutral position. There may be more than one way to restrict motion of a spine during the primary and secondary assessments. EMS systems have specific guidelines for when to use and when not to use manual stabilization and spinal motion restriction. The look test. Getting a feeling about a patient's condition from environmental observations as well as the first look at the patient. The look test identifies patients who may be critical. Patients who appear lifeless, resuscitation by beginning CPR compressions is needed. Prepare your AED as soon as possible. Patients who have an obvious altered mental status and patients who appear unusually anxious and those who appear pale or sweaty. You want to identify patients who may be critical. Obvious trauma to the head, chest, abdomen, or pelvis. Specific positions indicate stress. If they are in a tripod position, they probably have difficulty breathing. Or the Levine sign, which is chest pain or discomfort. The chief complaint. That is the patient's description of why EMS was called. It may be specific to abdominal pain, but it may be vague to not feeling good. This is when you need to ask more questions to get a better indication of what is going on with your patient. Form an impression of the patient. So you want to look and then the patient's age, their sex, and position. And then listen. The moaning, the snoring, or the gurgling respirations. And then smell. Hazardous fumes, urine, feces, vomit, or decay. Altered mental status, or the AVPU. So the AVPU stands for alert, verbal, painful, and unresponsive. So if they are alert, that means that their document orientation to person, place, and time. Assess the ABCs. The order of primary assessment will vary depending on the patient's condition. Airway, breathing, circulation. You want to identify and correct any life threats and gather information that will help you later in your assessment. Look for signs of life, including movement. Scan the chest for signs of breathing. If no signs of life, such as breathing, or only gasping breaths are found, you want to check for the pulse. In your airway, if the patient is alert and talking clearly or crying loudly, then the airway is open. If the airway is not open or is endangered, take measures to open it and clear any blockages. Next is breathing. Situations calling for breathing assistance included if the patient, 1, is in respiratory arrest with a pulse, is not alert with inadequate breathing, has some level of alertness with inadequate breathing, or has adequate breathing but signs suggesting respiratory distress or hypoxia. Circulation. Assessing the skin. If you are in good condition, the patient will be warm, pink, and dry skin. If they are in shock, they will be pale, clammy, cool, and moist skin. You want to check the pulses for no longer than 10 seconds. If you don't find a pulse within the 10 seconds, then you're going to start CPR. 3 results of assessing a pulse are either 1, they are within normal limits, they're either too slow or too fast. And then you want to check for and control any severe bleeding. Next, you're going to determine the priority. You're going to treat any life-threatening ABC problems as soon as it is discovered. To be stable, a patient needs to have vital signs that are within the normal range or just slightly abnormal. And a threat to the airway, breathing, or circulation, either actual or imminent, rules out stable. Remember, if there is no pulse, you want to begin CPR compressions while the defibrillator is being readied. There are many times when it is not crystal clear what a patient's problem is, so there will be many possible diagnoses, some more serious than others. A patient's priority can change. You want to initiate priority transport if a life-threatening problem cannot be controlled or threatens to recur, or if the patient has a depressed level of responsiveness. You want to continue assessment and care en route. Here's something to think about. Why must you continue to reevaluate the primary assessment? Remember the baseline set of vitals and the trends. So that's what this is talking about. Another thing to think about is how might normal findings in a primary assessment differ for a child compared with an adult. Patient characteristics and primary assessment. The patient assessment takes different forms depending on certain characteristics of the patient. The patient may have a medical problem or trauma. The patient may or may not have an altered mental status. And the patient may be an adult, a child, or an infant. Let's do the chapter review on the primary assessments. The primary assessment is a systemic approach to quickly finding and treating immediate threats to life. The general impression, although subjective, can provide extremely useful information regarding the urgency of a patient's condition. The determination of mental status follows the AVPU approach. Evaluating airway, breathing, and circulation quickly but thoroughly will reveal immediate life threats to the life that must be treated before further assessment. Your approach to a patient will vary depending on how he presents. The American Heart Association recommends a CAB approach for patients who appear lifeless and apparently not breathing or have only agonal respirations. This begins with the pulse check and chest compressions if there is no pulse. If your patient shows signs of life, including moving, moaning, or talking, and is breathing, you will take a traditional ABC approach. Remember that the mnemonic ABC is a guide to interventions that may be taken. You will choose your interventions based on the patient's immediate needs. They may be done in any order that fits the patient's needs. The patient's priority describes how urgent the patient needs to be transported and is how to conduct the rest of your assessment. Remember, you want to determine if a patient is responsive or unresponsive, whether the patient is an adult, a child, or an infant. Rapidly identify the need for immediate airway intervention and determine if the patient's condition is stable enough to allow further assessment and treatment at the scene. Questions to consider. What factors will you take into account in forming a general impression of a patient? The general impression combines the environmental findings and initial patient findings, so it is important elements to include in your chief complaint the environmental clues such as the mechanism of injury and the level of distress that the patient is having. And how should you assess a patient's mental status with regard to the AVPU levels of responsiveness? Remember, AVPU is alert, verbal, painful, or unresponsive. Some more questions to consider. How should you assess your airway, breathing, and circulation during the primary assessment? What is meant by the term priority decision? Critical thinking. A middle-aged male is lying on the street after being hit by a car. He appears unresponsive as you approach. You notice that he is bleeding from a laceration on his forehead and making gurgling sounds from his airway. If you are alone, what factors do you consider in deciding what to do first and why?